Ever wondered what really happens when you break your arm? We all think it's pretty straightforward. A snap, a cast, and you're good to go. But the journey from that initial crack to a full recovery, well, it's actually an incredible story. And in this explainer, we're going to uncover the surprising truth about humerus fractures.
So what does that journey actually look like? We're going to follow the whole story of a broken arm, right from the moment of impact to the very last stages of healing. And along the way, we're going to see the key moments and decisions that determine whether you end up in a simple brace or on an operating table. And boom, right off the bat, here's the first big surprise. You'd think the goal's always to get the bone perfectly straight on an x-ray, right? I mean, that makes sense, but that's not always the case. We're about to find out why good enough is often way, way better than perfect when you're healing a broken humerus.
Okay, let's dive into those first critical moments, right after the fracture happens. Because you see, it's not just about the bone, it's about everything around it, all the vital stuff that can get caught up in the mess.
You know that crooked, deformed look of a freshly broken arm? Well, it's not random at all. It's literally a muscular tug-of-war. Just imagine it. Your big pec muscle is pulling one piece of bone in, while your deltoid is yanking it out. And then your bicep and tricep are pulling the bottom piece up. It's this perfect, though probably very painful, demonstration of anatomy in action.
But here's the thing. Before doctors even really start worrying about the bone itself, they turn into detectives. And their number one clue? The radial nerve. They do a super simple test. Can you give a thumbs up? Can you extend your wrist and fingers? That one little move tells them almost everything they need to know about the health of this incredibly important nerve. Now, if there is a nerve problem, it's usually this thing called neuropraxia. The best way to think about it is like this. It's like a power surge that just temporarily knocks out the lights. The power lines, the nerve itself, are all still intact, but the signal just isn't getting through. It's a huge distinction, and it makes all the difference in how doctors approach the treatment. And this is exactly why that nerve check is so critical. For certain types of fractures, like a spiral break way down near the elbow, the risk of this temporary nerve injury jumps to a staggering 22%. Think about that. That's almost 1 in 4 patients. It's why doctors are always on high alert for this specific issue. So once the nerve situation is figured out, we get to the big question. How do we fix the bone itself? And this right here, this is the fork in the road for every single patient. A simple brace or a trip to the operating room. Now, this isn't some guessing game for the doctors. They've got very clear guidelines, but what they consider acceptable might actually surprise you. A bone that's bent by 20 or even 30 degrees, or one that's a little bit shorter than it used to be? Believe it or not, that can often heal just fine without any surgery at all. The OR is really reserved for the most serious cases, like when the bone actually pokes through the skin. And for most people, that non-surgical route is a huge success. The secret weapon is a simple little thing called a functional brace. And what's so cool about it is how it works. It basically uses your own muscles and soft tissues to gently squeeze the bone fragments together, creating the perfect little home for healing. With a 90% success rate, it just goes to show you the power of beautifully simple, low-tech solutions. But what about that 10%, the ones who do need surgery? Well, the question then becomes, what's the absolute best way to fix the bone? And the choice really comes down to 2 main options. A metal plate held on with screws, or a long rod that gets inserted right down the center of the bone. And when you look at the data, side by side like this, well, it's not even a close contest. A clear winner just pops right out. As you can see, plates outperform rods in pretty much every single category that matters. Better function, way less shoulder pain, and fewer complications. It's really a slam dunk for the plate and screws.
Yeah, the evidence is pretty overwhelming, and the source material is very direct about it. If you want the best possible functional outcome for your arm, getting back to as close to normal as you can, a plate and screws is the way to go. It's really considered the gold standard for this type of surgery.
So, whether you've healed up in a brace or with surgery, we come to the final chapter, recovery. And while most people heal up without a hitch, it's still really important to know about the potential roadblocks you might find on the path to getting back to normal.
In the story of recovery, there are kind of 3 main villains that doctors are always watching out for. First, the bone can heal at a little bit of an angle. Second, the 2 ends of the bone might just stubbornly refuse to join back together. And third, that pesky nerve issue we talked about can make an unwelcome return. But here's some really, really good news. The most common of these complications, that slightly angled bone, it usually doesn't cause any problems at all. Your shoulder and your elbow are just amazing at compensating for it, so even if your arm isn't perfectly ruler straight, it'll still work just fine.
And what about that nerve injury? The one that was such a big deal at the beginning? Well, the news here is just overwhelmingly positive. An amazing 90% of these stunt nerves wake up all on their own within about 3 to 4 months. So doctors just watch and wait, and only if there's no improvement after that 4 to 6 month mark will they even start to think about another surgery.
So what can we learn from a simple broken arm? It's really this perfect illustration of the delicate dance between nature and science. It shows us the incredible, incredible power of the human body to heal itself, and also the amazing things that modern surgery can do when it's truly needed most. It really makes you think, doesn't it?